the term advocacy doesn't mean that we are going to government all the time and knocking on the door and demanding more money for more treatments and that. What it really means is that advocacy is a very broad. It's advocating for patients to ensure that they are getting access to the best treatments that are available. So just some stats that I want to give you. Kidney cancer in Canada, 6,600 people are diagnosed with kidney cancer last year. The expectation that number to remain steady. In fact, that we are seeing diagnosis rates going up around the world, and we believe that that is because we are seeing better imaging. 1,900 people will die from the disease, and that is a number that we really need. We need to turn that, and as you heard, that there are new therapies and new treatments that are becoming available, and that's really important. Treatment for metastatic kidney cancer. Now, this comes from CKIS, the Canadian Kidney Cancer Information System. I don't even know my own trivia questions now. So what you see is that generally, if we look at a group of patients from 2011 to 2018, and we'll just have a look at these numbers here. So you can see that of those patients, 30% did not go on a TKI, which was the standard of care. Generally, now standard of care has changed for first line. First line, 69% of patients ended up there. 36% go to a second line, third line, 17%, and fourth line. What this means, though, in simple terms, is on first-line treatment, if you fail on first-line treatment, and first-line treatment, now the standard of care is going to be the Ipi/Nivo, Yervoy, and Opdivo. And what it means is if you fail on that, then what options are going to be available for you in second, third, and fourth line? Well, right now, there's not a lot of evidence in second, third, and fourth line. So we need to advocate using the Canadian CKIS, Canadian Kidney Cancer Information System. We need to use that information, and basically trials are investigator initiated to ensure that we're in a position where we can move treatment therapies and we can have them available and paid for by the payers, whether it be private or public insurance. And moreover, we need to be able to create the evidence so that we know what drugs can be available as a community for patients as they go along their different care pathways. So that's why that slide is there for you. So our vision is to improve the lives of Canadians affected by kidney cancer. Everything we do is based on that. We asked patients across the country back in 2016, what were their met or unmet needs? And we asked them this question in a survey that we ran with UNH, the hospital, University Hospital Network in Toronto. When your doctor diagnosed you with kidney cancer, please indicate whether they discussed any of the following with you, and we asked them to select all of the answers that applied to them. And this is what we saw. The specifics of the disease were discussed, information about general information, 82% prognosis. But when we get down to this number here, this is the number that really is a concern for me. It's this 36%. And we looked at that in our survey and we said, well, that's astounding because hands up all the patients in the room. What was the first thing, when you got the diagnosis, what was the first thing you went looking for? Information. And if you don't know, I described it as like saying to everybody has to move to Kapuskasing tomorrow. Well, where's Kapuskasing? If you don't know where Kapuskasing is or you don't know where there's a roadmap, how on earth are you going to get there? So this was a concern for us. And we also asked them what were their other unmet needs. And this one was another number that came through. Information they wanted provided in a way that they understood. We've been throwing around some clinical terms up here, and I desperately ask anybody speaking not to use long words because I have a sleep apnea and I fall asleep. So that's the first thing. But the second thing is most people don't understand what they are. So we then asked them, where did you go to get your information? Where are the top areas? And this is interesting. If you look at it, oncologists and urologists came out first, 67%. Kidney Cancer Canada was second at 55%. And the family doctor was next at 50%. But then we said to them, okay, of that information that you got from guys like Anil and Christian, and especially Christian, how happy were you? And with that information, how valid? 52%. Kidney Cancer Canada, 35% they were happy with, 25% with family doctor. Now this came from 3 years ago. So we set out to fix that. We said that that's not acceptable to us. We want a better relationship with our patients. We want to make sure that the information is being given to them in a way that is clear, concise, and that they can understand. So once we looked at these numbers, we said to ourselves, how do we improve 35%? So we developed the Kidney Cancer Video Knowledge Library, and a live demonstration is upstairs in the Knowledge Center that you can check out. And we encourage you to go online. You'll find it on the website. It's a big banner there. You'll see if you go to the website. Also, there's a small little button there that will go. Once you click on that, it will take you to this area here. And these boxes are basically in a way that shows you where you may be in your cancer treatment. So symptoms, we broke it down into how you diagnose kidney cancer, post-kidney cancer diagnosis, before kidney cancer surgery, post-kidney cancer surgery, localized kidney cancer, general bucket, and advanced kidney cancer. And once you click on those areas, you are going to find that there's a list of questions. We have hundreds of questions in there that clinicians have answered in about 20 to 40 seconds each answer. And you can type in, what is a TKI? Hands up anybody who doesn't know what a TKI is. Hands up who don't know what the vena cava is. Yeah. You can find that information all on the website because it's part of the treatment process that you go through, and it's information you're going to need, especially when your clinician is throwing it out there. So the results were rather interesting. These are people from all over the world are going to the Video Knowledge Library. You can see that generally most of it's coming from Canada, but we're getting a heavy response from the US. And those, in fact, are the top country users: Canada, United States, Australia, United Kingdom, Germany, New Zealand, Malaysia, Ireland, Romania, Pakistan, India, Mexico, Italy, and France. All over the world are coming in. In fact, we have people from all over the world joining us today online, so that's terrific. And these are the top 10 questions that they are viewing online. What are the symptoms? How does survival change in the past 5 years? All the way through to, what is a TKI? What is stage 1 cancer? I've been diagnosed as an intermediate risk patient. What does that mean? All of those kind of questions you can get, and you can play them over and over again. Other projects are working in the act. We obviously have patient orientation sessions. Soon, when a patient is diagnosed with kidney cancer, they'll be able to give a schedule, and we'll have online meetings to take them through the general questions that they need to know. I've heard in the break that people are saying, if only I knew this when I was diagnosed. So what we're going to do is set up online meetings that you can join in, and we will give you a roadmap, show you where you can get the answers, questions maybe that you need to ask. Regional meetings, we are doing a number of regional meetings. We're going to be going to Winnipeg, we're going to be going to St. John's in Newfoundland, and then we will be all the way across the country. We're also doing coffee chats in your area. Stay tuned. Just go to the kidneycancercanada.ca website on constantincanada.ca, and you will see this information there when we're in your neighborhood. We are also creating patient care kits that will soon be given to clinicians to be able to hand to you when you've been prescribed your medication. It will include moisturizing cream, tips on how to deal with rashes on your hands and pain in your feet. It'll have Imodium. Who needs Imodium? Me. Yeah. I always make this joke about it, but when I went on Suitant, I said the best thing that the company could have done at that time was to have included a localized map of where all the washrooms were. Because who's been in that situation where you're on the drug and you go, oh my God, I need a washroom. And I need it now, I don't know where one is. And then you panic. Will you be able to make it to the, I can't tell you how many women's washrooms I visited when I was on. I mean, people were saying to me, really, how do you feel comfortable going into a women's washroom? And I said, a lot more comfortable than pooping my pants in public, I can tell you that. And we're also working with clinician and patient groups, as we've talked about. World Kidney Cancer Day. It's coming up on June the 20th. Make sure you get a button. We'll be handing those out later, so that's really important. Thursday, June the 20th. to create awareness about kidney cancer. We're also using CKIS, and we're reaching out to clinicians. We're reaching out to health technology assessment and bureaucracy organizations to really lobby for the fact that they should be using real-world evidence when they don't have evidence about what treatments to go. And this is really what we've been talking about, shared decision-making. Here we have the patient lying in bed, and the doctors are all over him, and the lead doctor is saying, what? When we want your opinion, we'll give it to you. And that's important because I don't know, I mean, certainly, you know, I felt that way at the beginning of my my treatment plan, and Christian's my oncologist, but I don't feel that way with him because he's my second oncologist. I got a second opinion, and I felt far more comfortable talking to him than I did talking to my previous oncologist. And I think that's important. And a lot of people do get into that situation. So again, advocacy is advocating for yourself, giving yourself permission. It's your body. If you're not feeling comfortable about the treatment, my mom, God bless her, when she was alive, we convinced her to go to see a psychiatrist for a while. And she went once. And I would have paid for the rest of her life, to be totally honest with you, but that's another story. And she said, well, I didn't like him. Okay. He's not the only psychiatrist in town. But that is the thing that we're talking about, is if you're not feeling comfortable, how are you going to have a positive experience if you don't have a good relationship with your healthcare team? And that's really important. And people said, well, you know, I don't want to get a second opinion because it may offend him. Now, if we can get a mic to Anil, let's find out how he often gets offended. Because, Anil, perhaps you could just very briefly talk about, he's hiding in the back of the room now, to talk about that second opinion and how you would feel if a patient asked for a second opinion on something that's coming. Anil, there it is. How would you feel about someone saying, I want a second opinion?
I think that's great.
Okay.
I
he could answer the questions that briefly when he's sitting up here and the red light's flashing at him.
I think it's important to ask for a second opinion, but I also, only if you're not comfortable. So we do get second opinions at our center all the time, and some patients ask for second opinions after I give them my opinion. And I think that's important to feel comfortable with what you're going to go through. If you're not 100% happy or confident with the discussion that you've had with your oncologist or urologist, getting a second opinion doesn't mean that you don't distrust your first opinion, just that you want to have assurances about doing the right thing, because it's your body, it's your life, and you should empower yourself to not worry about that. So I always tell patients when they say, whether they get a second opinion from their family doctor or they get a second opinion and ask me to send somebody, I say that's fantastic. I think it's great. I want you to be comfortable with your management plan that we've outlined. And it's not about my ego, it's about your care. And I think that's really the most important thing. And if your urologist or your oncologist is worried about their ego over your care, then you definitely need to go get another oncologist or urologist, because it's not about the doctor, it's about your care and your health. So I personally am comfortable that I encourage that, and I think most doctors should do that, because again, it's about the patient, not about the doctor.
Thank you, Neil. Appreciate it. So how can we empower patients in this decision-making process? Well, we are launching today a new campaign, Patient Sovereignty. Basically, this means that patients own their disease. If we didn't have kidney cancer, if your loved one didn't have kidney cancer, Anil, William, Christian, everyone working at Kidney Cancer Canada, we'd be out of a job. Quite simple. So who do you think they should speak to when they're coming up with new ideas of what should be doing, or whether they should make a decision about whether a new treatment should be going? The patients. Patients need to be at the table, not on the menu. Right? And that is really, really important. We need to ensure. Got a question? Absolutely. Go ahead.
Just on the subject of a second opinion, I don't know how many patients here are from small towns or smaller cities where your options are pretty limited for a second opinion. Mm-hmm. I've had the case of
what I would say to that, John, if I could just okay, where you are if you have anywhere in the world where you live, if you have a telephone, if you have internet, that breaks all the barriers. And I'll tell you how we know that is because people call us all the time for other information, and the success of getting one of our medical advisory board, and Neil gives opinions all the time. Some of them we even ask him for. And it is really, I mean, I think the one thing about the internet, what it has done, it has broken down those barriers. Many areas are dealing with telehealth. So I would encourage you, yes, I know it could offend maybe the local area, but I think generally they should, I would pray, and we'll come and chat with them if we have to, that they should acknowledge that in these major centers where they are seeing maybe 50, 60, 70, 80 cases, in a month, it's going to be far better than the local doctor. Maybe he sees 1 or 2 kidney cancer cases in his entire life. One would hope that he would want help, or she would want help to bring you through. Does that kind of answer your question? Or it does?
I have something to add to that as well. I think there's 3 ways to get a second opinion. The first way is through your family doctor. So you see your oncologist, whether it be a uro-oncologist, urologist, or a medical oncologist, and you want to get a second opinion, not because you don't trust your first doctor, or maybe you don't, but you want to make sure you're on the right track because there's a lot at stake, like your life. So then you can ask your family doctor, say, I want to go to a tertiary care center, and they can refer you to that.
Can you explain the tertiary care center?
You can go to an academic, a university center, basically. You can go to a university center, and you can do that with either the knowledge of the original doctor or without the knowledge of the original doctor. Your family doctor can send you to a referral to one of the medical school centers or university centers, and then the original doctor doesn't have to know that, and that way you can get that opinion. You reinforce what you've been told the first time, and then you stick with your original doctor. Or you say, I'm not comfortable with my first doctor, I want to stay at the university center, and we're happy to do that.
Yeah.
Your second way to do that is to go to your original doctor and say, I have a good relationship with you, I really like you, but I want a second opinion, hope you don't mind. And that doctor should say, that's great, right? And they shouldn't say, go away, you don't trust me. They should just say, well, I understand that, and they will refer you. And I get that all the time from the original urologist. They come to me, they say, listen, my patient wants to have your opinion, and I'll reinforce or disagree with it. And then if I reinforce it, I encourage the patient to stay with their original doctor because, again, a lot of patients want to be treated in their hometown. It's just easier for travel in your own community. The third way is to go to Kidney Cancer Canada, and that's also a confidential way where you email, or I'm not sure how you do it, email, or you can text Andrew. He'll give you a cell phone as well. And then he contacts one of us, and we give an opinion on your file. Now, I would say that they're generic opinions because you don't have access to your entire file. Right? So when I get an opinion, I have to be careful not to say something stupid because I don't know all the nuances of your file. So that's not as clear-cut as a formal second opinion through a consultation, either from your original doctor or your family doctor.
Thank you. And if anybody online is in that same situation, and if you feel you need help or encouragement on how to do that, please reach out to us. We will help you. We do it on a regular basis. Very, very, very important. Patient sovereignty. We begin this campaign today. We're going to ask many, many other patient organizations to join us. And in the break, please connect with a board member because they have a free gift. We would like you to be wearing, anywhere you go, a patient sovereignty button, especially when you go and see your doctors, when you go and see anybody that's connected with the healthcare system, especially if you're going to see a politician, whether it be local, whether it be a school trustee. Patient sovereignty is important. Basically, you're saying, hey, look, I'm the boss here. Our opinion matters. We want to be at the table. Please. We shouldn't be asking. It should be a right that we're at the table. We've talked about self-advocacy. I want to tell you why it's so important, and I'll wrap up very, very quickly. In 2017, 680,000 impressions came to the Kidney Cancer Canada website and through engaging with us on social media and Twitter, Facebook. This doesn't even count the countless calls that we get on a daily basis. We've smashed that. 2018, we ended the year with more than 1 million impressions. So what that means is more people are reaching out, more people are getting involved, and they're getting engaged. And that's so important because that means better outcomes for patients.